We are going to go ahead and get started. So welcome this evening to Find Your Path. This is our MSW specialty event for any folks who have joined us as we've gotten started. We ask that you please mute your microphones till it's time for our Q&A. We are going to go ahead and get started. I'm Dr. Allison Tomlinson, the director of the undergraduate programs, and I chair the BSW and Foundation Committee. And the Foundation Committee is responsible for making sure that our foundation level curriculum is thoroughly communicated to our student body. And so this event is open to both BSW and MSW Foundation students who are moving into the master's curriculum and looking to find their path in terms of concentration for your MSW study. We are going to get started this evening, and I've given a quick few notes, but I'm going to reiterate them. We will be moving fast because this event replicates speed dating. And so we are moving quickly through a conversation that is supposed to help you figure out which one of these wonderfully enticing specialty is your match that you want to be coupled up with. And so we will have presentations from Aging, Children and Families, CAP, which stands for Community and Administrative Practice, Health, and Mental Health and Substance Misuse. And so we will move through each of these, each presenter pair, because there's a student and a faculty member who will be presenting, will give you the quick speed dating version of why their specialty is amazing. And at the end, we'll have time for question and answer. So we ask that you please remain muted until the time for the question and answer, because our faculty and our student speakers will be moving pretty quickly through a walk in their particular concentration. So without further ado, I will just add one more piece of information, which is please stay on through the entire event because there are multiple chances to win a door prize, so to speak, virtually. And we hope that you will stay with us throughout this. This session will be recorded and uploaded to the School of Social Work webpage, and we are hopeful that students who view it will be helped by it and help find their path. So without further ado, our order of speaking for today, we'll start with the aging specialty. So Dr. Fields and Allie Miles are going to share about aging.
Okay, I have a presentation to share. I can share my screen.
Real quick, Dr. Tomlinson, do you want Q&A after each speed date or the very end too?
You can take the Q&A if you have some time left in your window, and otherwise we'll just push through to the very end for some Q&A. So if you could stay on with us, we'd appreciate it.
For sure.
And just to make sure,
thank you. Yeah.
Can you all see my presentation?
Mm-hmm.
Okay, perfect. Sorry.
Well, thank you all so much for coming tonight. I'm Dr. Noel Fields, and along with our wonderful student, Allie Miles, who designed this lovely presentation. I never could have created something quite so colorful and amazing, but I appreciate that she did to catch y'all's attention. And again, I'm just so happy to share with you about the aging specialty, about my love for gerontology, about working with older people and their families. Looking forward for Allison or Allie to be able to share with you about her experiences. And so just tune in, put on your seatbelt and sit back, relax, and let us tell you all about all that we offer UTA in terms of aging, the specialty. So again, my name is Dr. Noel Fields. I'm an associate professor. I've been at UTA, I think this is my 8th year, and I primarily teach in the aging specialty. I teach the class direct practice in aging, as well as family caregiving in aging. And I also have a lot of students I work with in internships that are virtual. Allie actually is doing one now. I've had some other students work on some research, kind of community-based research projects for their internships. I've had several students in aging decide to pursue a thesis, which is a great option we can talk a little bit more about later. I know across specialties, but I can tell you a little bit about in aging. And my research involves community-engaged research, working primarily with older adults and their family caregivers and their family members, particularly those who have memory impairment or Alzheimer's disease or related dementia. But I also have some really interesting research collaborations with engineering, where we're looking at transportation and transportation for older people, as well as for folks across the lifespan. And some really cool research around social robotics. I know you probably never would have thought social robots and older people and social work, but believe it or not, there is a connection. Great opportunities for some cool learning and research there. So that's a little bit about me. In terms of coming to gerontology, I actually, like some of you, originally thought I wanted to work with young people, teenagers, and I did that for a little while. And then I ended up, just by chance, working in a nursing facility part-time and just fell in love and never turned back. So I just really have a passion for the older population. So I know you want to hear from Allie about her experiences.
So I'm Allison, or Allie. I go by both. I am a MSW student in my advanced year. I have one semester to go after this one. I am in the aging specialty doing a thesis route. My thesis is focused with robotics and people on hospice. I'm also a graduate research assistant. I'm a graduate leader, student leader, and I work in the Connection Lab Tutoring Center. So I may have had the privilege of supporting you or your peers on a few of their papers. My interests are in hospice and end-of-life care, specifically with people living with dementia. However, every time we have a guest speaker or I have a new professor, I'm always motivated or inspired by their story, and I always want to check out what they've been doing or what career path they've taken. But most recently, I've been interested in the older population who are incarcerated. And the reason why I picked the aging specialty is because it's a population that's often overlooked, often forgotten. And in aging, you kind of get a mix of everything. You get to learn about how to support people of all ages, because you're going to learn how to support their family. You can get the mental health aspect of it, and it can be even a larger spectrum of supporting a community of older adults. So the next one. So you kind of, to get an overview of the aging program, you're going to learn about how to support the older adults and their families, being mindful of their cultural and spiritual background. You're also going to develop an understanding for various policies and services that impact this population. You're also going to get an understanding for how to support those who are dying and their loved ones.
So I just wanted to take a minute to talk about a few of the classes that we offer as part of the specialty. One of the classes is the death and dying class, although I believe this is offered across specialties, but we do have in the aging specialty kind of a particular way we teach it, since we're talking about older adults and their families in relationship to the topic. But this is a great class, and I can tell you, even way back in my undergrad days, which was a long time ago, one of my favorite classes I took was about death and dying as a sociology major. So I think it is incredible that we offer this class to our MSW students. It's a great class as we talk about dignity at the end of life, how we support both the person who is at the end of life, but also their families. Some of you might be interested in a career in hospice or palliative care. And we have some faculty with specialty in this area in terms of research and practice. So it's great. It's great. A great opportunity to learn about this topic. That's often something that we tend to shy away from talking about. But in reality, in social work, we're all going to be helping clients who are either have a loved one at the end of life or who are at the end of life. So this is a great course. We have an aging policy class, which is specific for aging policy. So important these days as we think about changing demographics in this country. We all know that folks are growing older, but what's also really important to remember is that with the numbers of older people, we have growing numbers of family caregivers. So some of you might be caring for an older person in your life. And there's a lot of need for to look at our policies that serve older adults and their families, because we need to be supporting our caregivers. And so this is a great opportunity to learn about different policies. I mean, certainly about Medicare and all the different programs that you need in terms of, if you think about those kind of programs we talk a lot about, even Medicaid, in terms of long-term care, things like that, but also just national family caregiver policies, other policies about intergenerational care. We talk about grandparents taking care of grandchildren. So there's a great many topics in this class. Great opportunity to learn about aging policy. And we also have a family caregiving class, which I'm a little biased, is one of my favorite classes because I helped develop it and I love to teach it. But I love the family caregiving class because there's lots of opportunities to have assignments where you're in the community, you observe a family caregiver support group, you interview a family caregiver who's taking care of an older adult. Just some great different exercises to get you out in the community. Of course, our program is fully online, as we'll talk about, but in all of these classes, there's opportunities to take your assignments into the real world. And your faculty that teach these classes have a wide variety of experiences to be able to help you along on that journey. So that's a great class, Family Caregiving and Aging. So I think this is my slide, sorry. So some of the benefits, I mean, Allie can speak to this a little bit too, but these are some of the benefits. So for some students, you know, we are a fully online specialty, and this can be really great in terms of flexibility. It also can be great for students that, you know, don't live in the DFW area, but still want to get an MSW and want to sort of have that niche area of working with older adults and their families. There's also a cohort option, which some folks really enjoy, getting to kind of study alongside the same folks through the program. I get to brag about the amazing professors. I won't brag on myself, but we have some incredible faculty that teach in this specialty that have a wide variety of expertise. I think you'll find that the gerontological social workers are a pretty passionate crowd. And I know my colleagues here and the other specialties are too, but there are several professors. We have probably one of the largest number of faculty in gerontology in the country. And I don't think a lot of people know that. So that's pretty great. And really our specialty is really very unique in terms of what we offer for against other programs in Texas, but also nationwide. And really, again, like Allie mentioned, you know, the benefits of picking this specialty are thinking about social work and thinking about supporting a population that is often overlooked but has growing needs. And really, when you think about working in gerontology, you're thinking about working across the lifespan. You're talking about working with families. Really, working in aging is working with families. Certainly, we focus on older adults, so we talk about older adults within that system and with that family system and within the communities of care. So those are a few of the benefits of picking the aging specialty. In terms of career opportunities, there are many career opportunities. We already talked about hospice. We have folks that end up working in veteran services. Some folks like myself came out of working in long-term care, nursing facilities, assisted living, adult day centers, senior centers, folks that are like Allie, interested in working with persons who are incarcerated in the criminal justice system, guardianship, adult protective services, mental health. I know, you know, there's a real growing need for LCSWs who specialize in older adults and their families. And so there's just a lot of opportunity. I think it's important for us to open our minds to thinking about careers in aging that are beyond just maybe what we think is the stereotypical, you know, working in a nursing facility, although I loved working in a nursing facility. If you take my classes, you'll hear me say that. But there's so many opportunities. And there's also opportunities to be an entrepreneur. I've had students who've gone on to want to open their own intergenerational daycare center, all kinds of things. So lots of different career opportunities and growing career opportunities in this field.
And so one of the student orgs that are here in the School of Social Work is a Gerontology Organization. I'm the vice president of the organization. And it's not just limited to students in the School of Social Work. It's open to all UTA students, graduate and undergraduate level. We are an org that tries to help students understand the aging population by offering guest speakers and different learning opportunities, networking opportunities as well. We bring in different guest speakers from around Texas and even internationally sometimes, if you consider Professor Bennett an international person. But we have student or speakers from guardianship programs, the NASW, various programs that of services that benefit the older adults, just to kind of get social workers exposed, or future social workers exposed to the services and career opportunities that are out there for students. We also do some community service and volunteer opportunities too, even for students who are outside of the area. Oops, I hit the back button.
So why does the older adult population need you? Why do families need you? Well, as I mentioned, we know the changing demographics. This is a growing area of social work. And again, as we talked about, there's lots of different opportunities. So you really can be creative. And if you're business minded, if you're direct practice minded, we have lots of alums in the area that run agencies that serve older adults that kind of take that more macro look. We've got folks that work, all kinds of in different places in terms of research institutes or other think tanks or whatever. So there's lots of different opportunities, but we would love to have you consider our specialty.
And so we hope that you do pick aging from a student's perspective. This is honestly one of the best specialties. Not trying to be biased, but we really are. We offer a wide variety of opportunities that kind of hit a little bit of all of the specialties, but we're focusing more so on a population that desperately needs social workers and desperately gets overlooked and really needs more people involved. So hopefully you guys will pick aging.
Or at least think about it. And please feel free to reach out to me at any time. I can tell you more about opportunities, and we have paid GRA opportunities. We have thesis opportunities. So reach out. Thank you all so much.
Thank you.
Thank you from our aging cohort. Thank you so much for your, from our aging concentration. Thank you for sharing. And so I believe it is time for one of our first door prizes. And while we're spinning the wheel for that, our children and family specialty, Dr. LeBrenz and Oscar Aguilar, can get started with setting up if you guys have a PowerPoint to share. And well, before that, we're going to spin the wheel. Here we go.
My computer just froze. Okay. I was like, it's coming. It's just delayed. Okay. Margaret Conley.
Margaret Conley, you have won a door prize. Woo! So Margaret, you will receive a gift certificate from the School of Social Work, and we will make sure that you get that. So we are going to move into our children and family specialty. You have the floor.
Great, thank you so much, everyone. So I'm Dr. Catherine LeBrenz. I'm a third-year assistant professor here at the UTA School of Social Work. And Oscar Aguila is our student representative on our Children and Families Committee. So he is also joining me this evening to talk about just children and families as a specialty, the type of work you can do, and why you might want to consider, or reasons to consider, this as your specialty. And so, I think you'll be hearing from a lot of different faculty and students tonight who are very passionate about the fields and the areas that they chose to pursue. And so as you all start to think about the MSW program and which specialty might be the best for you, I just wanted to open it up with some questions. I don't really have a long formal PowerPoint, but really just thinking about what you envision yourself doing following graduation, what types of settings or populations really drew you to social work, and what is it that you feel so passionate about, and why you're interested in the profession in general. One thing I think a common thread across specialties is that there's so much versatility and flexibility, and there is a lot of overlap. And so whatever specialty you do choose, you will have a lot of options, whether it's macro, meso, micro social work, whether it's a particular setting. And so with that in mind, I just wanted to start, after sharing those questions, to talk a little bit about my social work journey and how I got to where I was. And then I'll hand it over to Oscar to talk a little bit about his experiences as well. So I am now in academia, but I worked for several years prior to coming into academia as a practitioner in various fields. And so most of my time in practice was spent with child welfare, which is kind of ironic because, you know, in children and families, we really try to talk about how we're so much more than just CPS and child welfare. That's what I was passionate about. But even within CPS, I had a lot of different roles. And so I actually worked in Santiago, Chile. That's where I did my MSW, and that's where I practiced before moving to Texas. And I worked as the equivalent of a house parent at a children's home, so an institutional setting for kids that were 0 to 5. I did everything from initial assessments of child development to creating stimulation plans, education plans, intervention plans with the families of origin. I worked for 1 year specifically coordinating cases of medically fragile children, which meant going to the public hospitals in Chile, coordinating with all of the doctors, the specialties, trying to get a plan in place so that we could find permanency, whether that child would go back to their families of origin or to get adopted. And then I transitioned into what's the equivalent here in Texas of a conservatorship worker. And that's really what my passion was. And that's someone who works with families of origin who are experiencing challenges. And so through my work with that, a lot of what I did was referrals and coordination with substance use treatment, with mental health facilities, and really addressing the root causes of child maltreatment and what was leading families to have contact with child protective services. Outside of the realm of CPS, that's where most of my practice experience was. I also, as a gringa in Chile, so someone who spoke English, I was able to get involved with a few different projects with professors. And one of them was actually working with families of disappeared, detained, and murdered during the dictatorship in Chile. And so through those experiences, I became very involved with restorative justice, and I actually ended up blending that into some of my practice with children and families, recognizing the impact that structural policies and structural racism, bias, discrimination can have lingering from generation to generation. And we actually saw a lot of the families that were involved in child welfare were direct descendants of people who had been disappeared during the dictatorship. And so translating that here to Texas, when I first came to Texas, I got involved with a social work detention response team where once a month we would go to the immigrant detention centers and work in conjunction with lawyers to prepare families that were seeking asylum for their credible fear interview. And so a lot of that was doing a trauma-informed approach with the lawyers to process the narratives that usually it was mothers with their children were telling us, and helping to pinpoint which parts of their narrative would be the best to focus on at the court hearing. And then recently I've been doing assessments for asylum cases where, as a licensed social worker, I'm able to, from my background specifically with child maltreatment and cases of unaccompanied minors, talk about whether or not what they experienced in their countries of origin constituted child maltreatment, because that's one of the requirements to be eligible for one of the visas. And so again, that's just my journey. There's a lot of other areas working with children and families, everything from criminal justice to military families. There's school settings as well. And so for anyone that's interested in any of these topics, whether it's international social work, whether it's supporting families to prevent initial maltreatment, whether it's building resilience, I also am always happy to chat more just about some of the job opportunities. If you do pick this specialty in terms of classes, we also have a lot of, in my opinion, very interesting classes that you can choose. So one of the ones that I am really excited about is our clinical assessment of child maltreatment course. This semester, we're integrating an interprofessional education component to it. And so social work students are going to be working together with students from education and athletic training to actually work in teams to assess a case example and talk through what the steps would be to follow, whether it's maltreatment or not, and if they consider it is, what protocol would have to be followed. There's other courses that specialize in school social work, in policy, in family therapy. So again, really depending on your interest, there's a lot of opportunities and a lot of options to explore the areas that you're interested in. So I know I've talked quite a bit, so I want to turn it over to Oscar so that he can talk a little bit about what his experiences with the program, the work that he's doing, and you can hear from the student perspective.
Okay. Hello. So, sorry. So this is a specialty that I just really enjoy. I've been a CPS caseworker now for almost 7 years, and honestly, I kind of just fell into it. I'm not gonna lie to you, before I even applied to CPS, I did not know what CPS was. I was just that oblivious to it. And now 7 years later, I'm still here. So I really enjoy working with the population. I be able to work with the family as a whole. You know, a lot of times people think, oh, I'm working with children, that they're only gonna be working with children. I probably work with the parents more times, a lot more than the children themselves. And so you're working with the family as a whole. You're helping break these generational curses, especially sometimes if you're talking about like immigrant families, especially my Hispanic families. Like, when I'm trying to tell them, you know, how you can't physically abuse your children. You know, even people like in my family, like older generations, isn't seen as something bad. It's pretty norm. It's like, okay, well, this is kind of how it's seen here, how it's seen differently, and kind of changing those kind of generational curses, or just how people see, how families see things. And also, I think it's just working with children is so different than working with adults, and so I think this specialization in general will prepare you for that. In social work, with other specialties you might do or jobs you might do, you will probably end up working with kids, and in one way or another, whether it's the family, and I feel like this will help prepare you for that. Whether how do I say this? Whether you're working with the kids just for a little while, for a whole time, a lot of time, this will kind of prepare you for that. And kind of how you noted, especially with just a wide variety of jobs, a lot of times people think just CPS when it's like children and families, but you can do work a lot of different nonprofits, foster care, CPS, obviously private practice, schools, hospitals. So it's a lot more wide variety than people kind of think. And so what I like most about this program is a lot of the professors and instructors I've had, they have a lot of experience, kind of like Dr. Lebrenz kind of said what she done. It's not, they don't teach you just what's in the textbook, but really, look, I've worked this profession for this many years. I've done it, and this is what my experience is like. And I think that's just so helpful, because there's only so much a textbook can teach you. And so with that, I haven't met a professor that hasn't been very friendly, helpful, and I mean, I've never had any hesitation to reach out to any of them, whether it's over their coursework or just social work in general. So yeah.
Thank you, children and families. We appreciate your time and your sharing. We will save the questions for the Q&A, so this gives us a little bit of time to offer another door prize. But thank you so much, children and families, for what you all have shared about your area of academic interest and concentration. All right. So Elaine McDonald is our next prize winner.
Congratulations.
Awesome. So Elaine, you will receive a gift certificate from the School of Social Work. We will now hear from our health concentration, which will be Dr. Voss-Scragg and Diana.
Hi, nice to see you all. My name is Rachel Voth-Scragg. I'm an assistant professor here and in the School of Social Work. And I am here to talk about our health specialization. Students specialize in health, work with clients and families facing acute, chronic, and terminal conditions, and they also promote public health and work on public health campaigns. Students learn how to help patients understand illnesses, promote clients, and promote community access and community inclusion in a fast-growing and well-paying field of social work. One reason you might be interested in our health specialty is because we really emphasize experiential learning We emphasize interprofessional education, and we emphasize learning through doing and simulation-based activities across all of our courses. As a health student, you get to interact not just with other social workers, but with nurses, with doctors, with pharmacy and public health, with education and criminal justice, students from across UTA, and students from all over North Texas. This semester alone, our students are participating in Epic Day, which is a simulation of teamwork response to disasters. They are doing an escape room where they're learning about teamwork and implementing teamwork-based strategies. They are participating in a common reading on the book The Other Wes Moore with colleagues from nursing, public health, speech language pathology, and social and athletic training. And in our courses, you get to take classes like health insurance and access to care, health policy and social justice, intimate partner violence, and special topics in health equity. These all provide a broad background, not just for engagement in health, but in any kind of social work you might choose to pursue. We also have a fabulous student organization called Health with Hearts. They promote health social work with students, and they also provide opportunities for social engagement with each other and to learn more about what's going on with health social work. I'm going to share a video made by our health students so you can hear their voices, and then pass it to Diana to give another student's perspective.
If you're interested in working with diverse populations, health social work is definitely the way to go.
Hey everyone! So today I just wanted to tell you a little bit about the health specialty and why it's the best specialty.
A degree in social work offers an exciting career in a variety of settings and specialties.
There are tons of amazing professors who truly know what they're talking about and have tons of experience in the field.
This specialty has one of the highest salary outlooks in the social work profession.
From pediatrics and NICU all the way up through geriatrics and hospitals. There's someone who knows what they're talking about and knows exactly what it's like to be in our shoes also, and then they have their 20+ years of experience.
Social workers have a wide diversity of roles within the healthcare system. You might work in direct practice or service planning, and you will also have the opportunity to work in healthcare policy, where a social work perspective is definitely needed.
I personally want to engage as a medical social worker. I look forward to working with a team of healthcare professionals to assess a patient's needs and to plan their care.
In addition, we have great interprofessional activities where we get to work with students from nursing, medicine, dentistry, athletic training, anything you can think of, they're there.
As our society realizes how important mental health is for a person to have a happy and a thriving life, we're looking for that support to come from social workers.
It truly has been a phenomenal experience as a faculty member to watch students take the information that they're learning in their classrooms, practice it, apply it, and turn it into lifelong knowledge.
Social work is everything that I believe in. I believe in justice. I believe in fighting for the underdog. I believe in helping those that are vulnerable. I look forward to serving my community as a social worker.
And I'll hand it over to Diana.
It's so fun to watch that video. Several of the folks on the video were classmates of mine last year and have graduated, so it's great to see them. My name's Diana DeCesare. I am a non-traditional student here. I have always been fascinated by the healthcare field. I was pre-med in college. I have a bachelor's degree in biology, and then sort of explored a lot of other health fields and ended up working in pharmaceuticals for many years. Through that work, I had the opportunity recently to meet oncology social workers and participate in one of their annual, well, several of their annual conferences, which I attended. And the first one I walked into was like, I found my people, amazing people. So oncology social work is a subset of healthcare social work. As you've heard, healthcare social work is pretty broad, and it actually spans the populations that have already been spoken about, from Dr. Fields and her group and the children and family group. So depending on where you practice, you'll hit all of those. You can hit all of those populations. If you like to watch medical shows on TV, which I love, I'm like a little addict, Chicago Med, whatever it was, Emergency back in the 70s. If you're older like me, you might remember that show, ER, depending on your generation. So I'm always fascinated by the medical shows. Having been through, I graduate in less than 2 months, about 7 weeks, I'll be graduating. And I've been in the program since 2018, so I've sort of been taking my time. One of the great things that I'm excited about is being able to, now the lens through which I watch these medical shows, it's different because of the social work classes I've had. I see the mistakes, I see discrimination, I see disparities that impact people. And now I'm educated to the point that I know how to advocate more effectively and speak up. I've really appreciated the interprofessional education programs. We get a certificate in that if you participate and document your performance in that participation. And it's really been helpful. I've been doing my internship since August of last year. It's a split internship at a cancer center in Fort Worth. And I do work side by side with doctors, nurses, nurse navigators, medical assistants, administrative professionals, public health people, all kinds of people on a daily basis. It's all of these different people and coming together to help remove barriers for patients and get them treated. The two areas that I'm looking at, I'm hoping to get a job in. I love hospice. I was a hospice volunteer back in the 90s, and I have a passion for serving that end of life patient, which another one of our students, I think, Allie, you mentioned your passion there as well. So the health concentration can fulfill that need in addition to the aging. I think one of the things I like about the health is that it's really broad. There's just so many different aspects of health, whether you work in pediatrics, in a general hospital population, or in specialized, whether there's transplant, oncology, hospice, palliative care. There's so many different ways to specialize, and it's highly professional and very collaborative. So I really like the collaborative. And there's also nonprofit. There's an organization called Cancer Care Services. And two of my classmates from last semester that graduated in May of last year, or August of last year, are now working at Cancer Care Services. And they really love working for a nonprofit agency that serves patients who need it. I'm working on a project in my internship on social determinants of health, where we're developing a screening tool to help identify patients who are at risk and needing more social services instead of waiting for them to get referred to us from their physician. So I love the proactive nature of that. So those are just some of the things that I appreciate. The professors, everyone has mentioned it. So I think shout out to Dr. Mitchke and UTA. The professors are second to none. They're adjunct, so they have the real world experience, and it really makes your learning much more credible and real. You can apply what you learn in the book to the real world setting. I've really appreciated that piece of it. And then finally, there are great opportunities. I think this is such a growing field in healthcare. Everyone's going to need healthcare. Everyone will need it. And so there's just a lot of job opportunities. And it was mentioned in the presentation, and I didn't do it for this reason, but it is one of the best paid social. And there's a lot of talk, if you follow any of the Facebook groups, about social workers not getting paid their value. But in healthcare, it looks like many areas you're getting paid what you're valued, the value that you bring to the healthcare team. So I think, it's not the reason to do healthcare, but it certainly is an added benefit that your work will be compensated in a fair and respectable way. So I think that's it. Oh, did I mention Health with Hearts? You mentioned the student organization. So I've been involved in that for 2 years, the last 2 years as president. And it's a great group. We've grown from 15 members to 45 members. And we do a lot. We get to hear from alumni. Actually, Vidya, who you just saw in the video, is going to be coming back and talking to us in 2 weeks at a meeting. So we do a lot about how to navigate in this world. We have a group me group, alumni group. So we support each other with job opportunities and networking. So there's a lot that the healthcare, I think we're just so collaborative in the way that we're trained that we've collaborated together to work, to share opportunities and network. So those are my thoughts.
Thanks.
Thank you both. We have just a little bit of time. So as Dr. Hunter cues up the spinning wheel, I will go to the chat and ask a question of the health cohort. I'll let you respond to this. Is health still for students attending in person? is a question you got, and someone did respond and say, yes, the health court is a campus-based cohort, but I didn't know if there's anything that either one of you would like to add to that.
You will need to take some courses in your concentration year on campus at this point, but there are also courses that are available online. So not the full program is not online. There will need to be some residency at UTA at this point, but we're trying to grow and want to, come join us, and we'll get big enough to go fully online too.
Thank you. That actually captures, I think, most of the dialogue that I've seen in the chat, which was about if at some point they can go to classes online. So you captured that. I see you putting a plug in to increase your specialty numbers. I appreciate that. All right, so we will move to our spinning wheel, Dr. Hunter. All right, Charmaine Asbury, congratulations, you're a winner. All right, Charmaine, you will receive a gift certificate as well. We are keeping your names, and we will be reaching out about the gift certificate after the event. Congratulations, Charmaine, and to our other winners. All right, so now we will hear from our mental health substance misuse cohort, and we will hear from Dr. Don Schumann and Rita Brennan. Thank you. Dr. Schumann.
At least it tells me I'm muted when I'm muted. So good evening, everybody. I'm really glad that you're here, and I want to welcome you to the Find the Perfect Fit for You specialty event. If it's okay, I'll go ahead and share my screen. Allison, I love the spinner. I love the spinner wheel. Okay, let me see if I can find out where my document went. Sorry about this. Okay. And hopefully, wow, it just took off on me. Hopefully you can see the slideshow that I've got here. Okay. And if not, somebody say something. So my name is Don Schumann, and I'll be talking tonight. I'll be joined by Rita, who is a direct practice student, and I will let her tell you all about her. What I want to talk to you about tonight is the clinical social work, mental health, substance use disorder specialty. And the previous presenter was talking about clinical learning, clinical information. If you want to be a clinician, if you want to practice diagnosing, and you want to practice doing this across a broad spectrum, then this is the specialty for you. Not only do we have mental health, emotional health, behavioral health, in all the genre, couples, families, groups, communities. We have the substance abuse or the substance use arena. And if anybody's looked at the TV or any material online lately, you know that we have an incredible crisis going on with substance use and substance use disorders. Just a couple of gee whiz slides for you before I let Rita tell you the real deal. I'm just the warm-up act here. The vast majority of mental health services are provided by social workers, and this has been true for a long time. A few thoughts about mental health in the United States. We have come a long way as a society, but we have so much further to go. 50% of all lifetime mental illness begins by age 14, 75 by age 24. What's that tell us? Early detection, early identification. substance misuse is an expanding, thriving, growing, cutting edge field. We aren't just sitting in rooms in circles talking about the Serenity Prayer. We are inside people's brains. We are dissecting people's brains, and we are figuring out more and more every day. We learn more about the reward pathway, the dopamine pathway, the serotonin pathway, and this is just exciting, extraordinary work. And so hopefully that got your juices going just a little bit. And now the main event. Rita, are you ready to take this show on the road?
I am ready to take it from here.
Okay, it's all yours.
Okay, thank you. My name's Rita Brennan. I am an advanced graduate student finishing up my last couple of classes, my advanced field placement, and my either the thesis route or the integrative seminar. I'm still toying with that idea with the thesis route, just the way my classes are landing this semester and next. Because I want to go into research, but that's the last little bullet point here on this. I know that I chose the mental health and substance misuse because I knew I wanted to continue working in a helping profession. The coursework it focuses on the information that I'll need to be able to pass the LMSW exam, and then later the LCSW exam once I've finished my 2-year supervision. Additionally, I qualify as an LCDC intern once I graduate, licensed chemical dependency counselor. So that gives me a couple of certifications and licenses that will broadly, enhance my professional opportunities. Because I do want to work with people with substance misuse, adolescents and young adults. Our Surgeon General said that our number one health problem right now are children and mental health due to the COVID pandemic, that they have been hit super hard. So with I'm a mom with a recently emptied nest. So let me go help the kids because I have a lot of mom energy still that I can apply there. While using the classes will help me use the DSM-5, our diagnostic manual, because trauma and substance misuse go hand in hand. It's two edges of a sword. Either the trauma comes first, which leads the person to a maladaptive behavior of substance misuse to forget about the trauma, or while a person's in active addiction, they experience traumatic events while they're under the influence, none of which they'd be able to process. And if you're drowning your sorrows, so to speak, from a traumatic event, you're not able to process that effectively either. So trauma is a huge part of substance misuse and mental health. If you just think about a person making the decision for whatever reasons that are influencing them to go seek treatment. Usually there's pressure from an outside agency or the family, which can be traumatic in and of itself, the person choosing to go try a life without drugs or substances. When they've never done that before, that can be terrifying for the person. And you don't have to change one thing, you change everything in your life when it comes to addiction and substance misuse. So we do a lot of trauma-informed care. And our advanced coursework does prepare us to continue with either a Doctor of Social Work, which is a practice doctorate. We learn more about the clinical aspects and better practices inside how to be a better counselor, or you can do a PhD route, which is the research, finding out what works, how you can use it in private practice, what makes people tick, what kind of medicines work best for other people. And that sounds like a lot of fun. I'm the research kind of dork. I've had a lifetime of experience with mental health and substance misuse. I myself am in recovery for pushing 16 years. my parents were in recovery. My brother was not in recovery and passed away from AIDS a couple of years ago from IV drug use. And why did I choose it? Well, mental health pretty much affects everyone. No one comes into a situation needing a social worker when everything's going well in life. People seek out the services of social workers when there's something going on and they're not able to navigate the obstacles in front of them, or they may not have the social skills or the treatment ways to behave and just behavior patterns that will help move them forward and through really bad events. So it touches everyone, no matter what your demographic is, if you're with the child and families or in the health situation. Mental health and substance misuse will likely touch your life just because of the prevalence around it. It's touched my family greatly, and I've been able to use, we'll talk about this later, that I've been able to use the materials I've learned in my courses in my current life, in my present day life, such as the use of learning about Narcan, where to get it for free, where it should be able to find, where you should be able to find it, how to use it, how much you need. And I brought my ex-husband back with the use of Narcan back in October. He had stopped breathing. Which was a terrifying thing to see. That was the second time I'd seen it. On our next slide, we talk about some of the classes. Direct practice in mental health and substance use, 5352. That's how to work with people experiencing the mental health issues or substance misuse. What causes it, the historical treatments, and how we use the DSM-5 to work with those with the substance misuse, because usually there's an underlying mental health issue, be it depression, bipolar, borderline personality, something where people are self-medicating. Sometimes you can tell by the drugs sometimes that people with anxiety tend to use alcohol more. People could be self-medicating ADHD with the use of the stimulants. People can be compensating for social anxiety with alcohol, and it just goes on and on. It's a person with a substance misuse issue has an underlying, usually will have an underlying mental health issue that they need help with. And if you can help with one, the other usually falls into place. And then we'll go to the next slide. Direct practice helps with that. The principles of substance use treatment, which I'm taking now this semester, shows the theories behind it, what causes people to, what can make one person be able to use substances and another to go off the rails using substances and form a use disorder. We've differentiated between addiction and substance misuse. Addiction is the brain, the biological part of the substance misuse. It's when the substances hijack the brain and cause the person to want more and more and more, as well as the withdrawal process when a person no longer has that drug in their system, such as the hangover you experience the day after drinking is a form of withdrawal. We see the classic person with heroin who has to get the shakes and is sweating and is in dire straits and needs medical attention to do that. And this class also, helps with finding ways to reach the person you're working with who has the disorder, to help them see what's going on and how they're affecting their lives and negatively, and reasons to maybe not use the drugs in such a way. Okay, why I chose this specialty. We use unique in-person environment, strengths-based approach to the understanding of mental health. People with mental health issues also have strengths that we can rely on, and a lot of times we forget about that. Just because a person has depression doesn't mean that they lack the self-awareness to say, hey, something's going wrong, I don't feel right, and to seek treatment. And that self-knowledge and the ability to know yourself and know where you are, that's definitely a strength, as is finding out like what kind of support groups they have or support network within their family and friends. it does help me conceptualize how to use the services, especially with the connection between trauma and substance misuse. I have met very few people in my 16 year, almost six, well, I've been in the program a little bit longer than 16 years. Had a little slip up there in the beginning, but I have rarely met anyone who did not have some form of trauma, who also had a substance misuse issue. Usually for women, there's a lot of interpersonal violence and trauma. Kids who are using drugs in their teen years and their adolescent years, there's trauma at home somewhere because they're seeking out an external factor that they have not found at home to meet needs that they have that are being unmet. Dr. Schumann spoke of the cutting edge treatment. The class with the addiction doctors is fantastic. I learned so much in that class. That's where I learned about the Narcan and how to use it and when to use it. And that made a great difference in my life and the life of my kid's father. So that was a good thing to learn. I apply these kind of things all the time in my life. I work with sponsees who are 2-3 days clean and use some of these techniques to help with them. Mental health and we have our own organization, the MAVs for Mental Health Awareness, and this is to provide UTA students information, education, social network for those interested in the same thing, the mental health and substance misuse, and to help teach us to become leaders in our field. We have a link for the membership. The annual fees are $20, and we have a big event coming up this week when we take over the Student Center with games and prizes and stuff like that. I think mental health, first of all, I go with what I know, mental health issues and substance misuse. That's just something I grew up with my family from every different angle imaginable, including my own. And it touches everyone's lives at one point or another. So the more I learn about this, the better I can help people throughout. It also opens up tons of different careers. Not just being a substance use counselor, but it's all working with people in the hospitals who are coming in with who are experiencing drug overdoses to try to get them into treatment. There are tons of different ways to use this. And if, I could get into a different specialty and for my career, but I can still take all the information I learn with this to use in my personal life as well as in my professional life. Unfortunately, we're not escaping it. And the pandemic has done nothing but heighten it for the kids. And then our next slide. This is how to follow us. Denise Draper and Tori Hopkins are leaders for the MAVs for Mental Health Awareness. So you can contact them for more information or click on the link from the previous slide. And then we have the different treatments and supportive services that we can provide with this specialty. Community behavioral health centers, independent providers, hospitals, community health centers, schools, jails and prisons, working with the divert courts, and working with primary care programs and teaching. One of the things I find most interesting and definitely want to at least volunteer with are the crisis response teams, where a social worker works with the police department to go out on the calls that are not criminal, but a person who is experiencing a mental health crisis, or if there's a situation where there's an altercation between partners, that we can come in and diffuse the situation in an effort to avoid unnecessarily incarceration and unnecessary police killings. The police aren't wanting to kill people, but with the lack of understanding and the lack of tools and what they are expected already to be able to handle, the mental health crisis is just a little bit too much. So going out there with someone, with the police, to help others in distress can help reduce the stigma of mental health and substance misuse, and as well as get people to the treatment that they seek and that they need. Here's the big fun thing for advanced student graduate field placement. we can qualify for a social work opioid workforce stipend. It's a $5,000 over the course of 2 semesters, so you do a split placement. And we have over 20 stipends awarded each semester. The application is open right now. I don't have the closing date, but I know that it is open right now for that. And it finds financial support from the Health Resources and Services Administration from the U.S. Department of Health and Human Services. The opioid addiction is a giant problem in most parts of the country. It's increasing in Texas. We have not yet seen the full brunt of the of opioids yet. That's still not one of the more common substances found with people who are overdose or have experienced substance overdose. Most of that is still the stimulants and combined with alcohol and other things. However, it's growing, and especially with the help of fentanyl. And that's about where I'm going to stay here. That's the opioid stipends. We need help with the opioid crisis. And
thank you, Rita. Thank you. I appreciate it.
Thank you, Dr. Schumann.
You know, as Rita was talking, I was thinking 33, 34 years in this field, and here are just a couple of the things that stand out to me are the professionals that work in this field, the people that pour themselves into this. I've never met more professional people than I have in this arena. They're passionate. People are passionate about what they're doing, and they're lifelong learners. We have to be. We're constantly learning something new. You know, I don't know if you know the research to practice cycle. From the time that we get a research finding or a result from a study, it can take 10 to 15 years to go through the evidence-based process and to actually get into the field and being into practice. That is a 10 to 15 year cycle that we are seeing down to like months to a year or so. So it really is cutting edge. And I will yield the floor now. We appreciate your time, and we hope that you come and join us. Thank you for letting us talk.
Thank you.
Thank you so much for what you presented. Thank you from the mental health and substance misuse concentration. We are going to have another spin of the wheel, and then we will hear from our last concentration for community administrative practice. We have some wonderful questions going on in the chat. We hope that you'll stick with us for Q&A. We may not be able to answer them all, but hopefully we'll be able to get many of them. And Renew Abraham is our winner. So congratulations to Renew Abraham. Okay, and I'm sorry, I hope I'm pronouncing your name correctly. So next we will have a presentation from our community and administrative practice concentration. And so I am going to yield the floor to our faculty and student representative.
Thank you. So my name is Amanda Ikanian. I'm an assistant professor here at the School of Social Work. I'm in my second year here. I'm joined here by Catherine, who's a current student in the specialty social chat with you after. So one morning, there's a massive thunderstorm happening behind me, so you may see lights and may hear some thunder. It seems to be passing by, but the lightning has been intense. I don't have a formal presentation. I thought I would be kind of informal and just talk about my own experience working in the kind of CAP area, and talk a little bit about why I think CAP is a great specialty for MSW students, and some of the classes I think are particularly beneficial. And then I'll let Catherine talk about her experience in the specialty herself as a student. So first, CAP is kind of loosely referred to as the macro social work specialty, and it's definitely focused on the ideas around kind of designing, developing, implementing, and evaluating programs, as well as working within communities and leadership positions within communities, and partnering with communities. That's definitely in the world of macro social work, it's kind of a small part of macro social work, but definitely, a departure from some of the more direct kind of clinical practice specialties that you've heard about so far today. So I'll talk about myself first. So prior to coming to UTA, I've been here for 2 years. I'm originally from the Northeast. Prior to coming here, I worked as a program evaluator for a little over 13 years. And I did program evaluations in Massachusetts and in New York. And really in that role, I worked with nonprofit and government agencies to develop new programs and to design evaluation studies to assess the impact those programs were having on the clients and communities that they were serving. And in most cases, I was working with agencies that had received federal or state grants to either create new programs or to expand existing services. And part of the grant requirement in a lot of situations is to have an evaluation component so that grant can monitor effectiveness and kind of demonstrate that they're having the impact or the outcomes that they were planning to have as a program. As an evaluator in that situation, I worked really closely with agencies to design evaluation studies that could really answer questions that are important to the program, and that could provide the program with data that they could then use to make decisions about implementation. So really helping programs make good data-driven decisions. As an evaluator, you also help programs make decisions about staffing, about what services should be retained or changed, what services should be added, how clients are recruited and retained, all sort of things around kind of broader implementation of a program. An evaluation can also help a program understand if things are being implemented as they planned initially. So I really think of an evaluation as a real tool for programs. It's not just a way of kind of knowing if a program is effective, but it's really a tool an agency or a program can use to make sure that the program is well monitored, that it's having the intended impacts, and that they're making choices and decisions based on data and evidence of their own program. For me, I've always really liked program evaluation because it combines my natural interest in research with my interest in community-based organizations and in social work. So I've never really been drawn to direct practice or clinical or therapeutic work. That never felt like a good fit for me, but I really like working with agencies and I really like working with social workers and kind of showing and teaching agencies and social workers how you can use research, use evaluation studies to strengthen practice. And so for me, the kind of CAP area has always been a real draw. And I went into program evaluation straight out of my undergraduate program and then worked up sort of over the last 13 or so years. So if you're thinking about CAP, I think there's a couple of things that you might want to consider, might want to think about if you're interested in the specialty. So I think CAP is a really good specialty for students who feel drawn towards management, leadership, and community level practice. So if you're interested in designing, running, or evaluating programs, I think CAP is really the right specialty for you. If you see yourself as being part of how an organization operates, how it strategizes, how it plans services, builds and grows its service offerings, then I think CAP is also a really good place for you to start. CAP is also good for those who are interested more in kind of the broader community context and landscape of social services. Leadership and evaluation roles are really excellent ways to get grounded in what's happening in a community and with what's happening within a service system, and not just within a single agency. You can learn so much more about what's happening in your community if you have to think broader than just sort of direct clinical skills or interactions. I think CAP is also really appropriate for anyone who has managerial or leadership aspirations. So skills like supervision, budgeting, grant writing are all really valuable for anyone who wants to climb a career ladder within a human service or social service agency. And really, because there's this sort of like universal relevance in some ways, I think the specialty is also good for students who maybe don't feel particularly drawn to any of the other concentrations that you've heard about tonight. Because a lot of the skills that you'll learn in the CAP program can really be applied across settings and across practice areas. So I'll finish with just sort of pointing out two classes that I think are particularly good in terms of delivering really good skills and knowledge. The first is a supervision class. So this is, to me, such an important skill, and many people end up in supervision roles without having received any supervision training at all prior to being in that role. And I'm sure some of you on this call have been in situations where you've had a supervisor who clearly didn't have great supervision skills. Maybe you've even been in supervision positions where you have felt, underqualified to be doing that. It's really common in social work to supervise, either informally or formally. So this kind of skill around supervision is really valuable. And then the second class I'll point out is the grant writing seminar. So, human services, social services agencies depend on grant funding. So a lot of time and effort goes into applying for grants of all sizes, be it small kind of foundation grants all the way up to really multi-million-dollar federal grants. And that grant writing is really important. And the more people you have, in your agency that can do some grant writing, the better. And that means that grant writing is an incredibly marketable skill on the job market. So having that skill, having that class on your resume is really beneficial, especially in the current context of dealing with impacts of the COVID pandemic and tight resources across many communities. So I'm going to stop here and let Catherine talk about her experience.
Hello, everyone. I'm Catherine Villarreal-Unicut, and I am in my second semester at UTA in the CAP program. And I do have a short presentation. Let me see if I can share that with you. Just a second, sorry. Okay, I'm going to talk to y'all about how you can have it all in the community and administrative practice portion of social work. Some of the reasons that I chose the CAP specialty is because, number one, I am a person with physical disabilities and limitations, and so I felt like a desk job was better suited for me when I started off in the social work profession. I love to facilitate needs assessments for agency enhancements, but also for my own personal research. I like gathering data and research on various client populations, and I'm allowed to do that in administrative work, working with different agencies. I also plan on using any evidence-based research and any research that I've gathered on my own for advocacy at the meso and macro level. And what I like about CAP is, first, I'm doing trauma research, and I have been able to do that with a variety of clientele from the different agencies that I've worked at. I have interned with a transitional housing program for sex trafficking survivors. And while there, I was able to review all the client case files. I did casework. I was a meeting facilitator for survivors daily. And so I was actually able to counsel with clients. I organized events to help that agency raise money. And we learn a lot when we're doing that. I also interned over the summer with a nonprofit foundation out of Arlington that focused on helping students that are in jeopardy of not graduating from high school due to economic challenges that they have in their families. While I was there, I was an event organizer. I created budgets, not just for grants, but also for the whole foundation as a whole. I did write grants for them. I helped them stay compliant with state and federal guidelines. I was a researcher. I reviewed their bylaws to make sure that they were all up to date. And if there was anything to be enhanced or added, I was able to do that for them. I was a meeting facilitator for all their volunteers, their parents, their students. We worked with 7 municipal courts in the Arlington area, 7 universities, and over 100 high schools. I did all of the communications for the foundation for them. I was their advocacy coordinator and also their volunteer coordinator as well. Currently, as I'm doing my internship at a corrections facility here in Lubbock. I am an all online student, so all of my UTA experience has been online, and I have a really good internship right now. It's a corrections facility. It's a court residential treatment center for only male inmates that addresses alcohol and drug abuse as well as criminal behavior. So it is a rehabilitation center for that. I'm acting as a counselor there. I also do some teaching classes. I have done a needs assessment for them and gathered data reports from the clients. I've done administrative surveys and created a curriculum that was based on the results of that needs assessment. So I've written a curriculum, a spiritual curriculum for them. I've reviewed and researched all the client files from the past and currently, and also done over 70 client interviews. They've given me lots of leeway because of the specialty that I am in. So that's been really nice. Some of the goals that I have with this degree are to complete my doctorate dissertation and have a focus on the differences in the trauma care from all the research that I'm gathering from different agencies that I'm going to get to work with. Currently, I'm interviewing to work with the DA's office here in Lubbock, working with inmates on death row. We do the research with their families that help humanize them. And that allows the court to decide whether or not they'll receive the death penalty or life in prison. So that's one of my goals. I'm also going to finish writing my police social work grant and curriculum that I want universities to implement. It allows social workers to be police social work first responders. So you're actually on the scene treating traumas, and you are the person, the social worker that those clients see from the very beginning to the very end, rather than getting transferred around to different social workers for different things. We would be trained to do it all from beginning to end. So when I say that you can have it all in community and administrative practice, you get to be teacher, counselor, caseworker, researcher, grant writer, administrator. There's so many aspects of it that I'm being allowed to do in my internship just because of the specialty that I chose. I don't feel like I missed out on anything as far as the variety of social work that's out there. I'm getting to experience it all. And then I'm getting to gather so much research for myself. And for me, that's a really big plus because I'm a research buff, and I'm really wanting to understand trauma in a better way and how to address trauma in different client populations. So I hope to see y'all all in some future CAP classes. And that's all I got for y'all. Thank you for letting me share.
Thank you all so much for what you shared in CAP. We have one more spin of the wheel. Carla Clark. Carla Clark, you are a winner. Carla Clark. Okay. Thank you all for sticking with us through the exploration of all the specialties. We are at the point where we can take a few questions from the chat or from those who would like to raise their hand or unmute themselves. We've had a lot of questions happening, excuse me, in the chat, and I don't think I could reach back and try to grab them all because there's been such a robust discussion. But if you prefer to put your question in the chat, that's fine, and I can pose it to the group, and where it's relevant, that faculty or student group can take it. But I'm sorry, I was trying to catch up with the chat, but where you would like to unmute, we can go ahead and do that. I see a hand. Pauline, if you'll go ahead and unmute and ask your question.
Hi. So for the MSW, will there be any information covering the the double majors, or do we just need to look online regarding those?
I can actually field that question. Or Dr. Mitchie has signed on to.
I was just going to say that, yeah, actually, we now have one of our MSW advisors, Leslie Reyna. She's one of our newest advisors, and that will be her area of focus. So if you have specific questions about a dual degree, you can reach out specifically to Leslie Reyna, and she should be able to walk you through any of our dual degree plans and answer questions about that.
Awesome. Thank you.
Thank you. Wonderful question. Thank you, Dr. Mitchie. And for those of you who didn't know we have dual degree programs, please check out the website and review there the types of dual degree programs that are available.
Second.
I had a quick question. Can y'all hear me? Michaela.
Sure. Yes, go ahead, Michaela.
I don't know if this is something that we can talk about today, but I was just curious on what is the process for the license or the LCSW or LCMSW? Because I think the last time I looked into it, it was we had to have 1,000 hours and all of that, but I just didn't know what that process was to get licensed and get the clinical license as well.
Sure. I can tackle that one, and then I know Dr. Schumann, if you want to jump in and add anything, because you've done a lot around licensing for the School of Social Work. But from a general perspective, so if you are pursuing a master's in social work, you would pursue your license as a master's level social worker in the state of Texas. And again, I'll be clear that if you are seeking to get licensed in a jurisdiction outside the state of Texas, you're going to need to make sure that you abide by the regulations in that jurisdiction. But according to the state of Texas, when you have completed your master's degree coursework, you will apply with now what's called BHEC, the Behavioral Health Education Council. The E might be wrong there, but you apply with the state entity to take the LMSW exam, and then to receive the LCSW or to earn it, you do a number of hours beyond receiving your initial LMSW license to become licensed as a clinically practicing social worker. It's the 2,000 hours or within the 2 years. And so you would accrue those hours. You would be responsible for seeking your own supervision. And the School of Social Work occasionally has licensing workshops. There's also a licensing presentation that's underneath the MSW map of the journey. And for students who are logged on, who are BSW students, that information is also available on the BSW orientation page as well. But there's a specific presentation comprehensively covering licensing and the licensing process. Okay.
Okay, thank you.
You are very welcome.
Could I just say that it is not too early for you to start talking about licensure right now. Because my daughter, and I'll just give you this, my daughter who is testing for her LCSW next month. Let's see, get the degree. I didn't get this posted yet, so this is what I tell her. This is what I told her. The time's going to go by whether you use it or not. 4 years from now, you can be getting your LCSW or not. So get the degree. Toward the end of your degree, you can actually test for your LMSW. And so you can have your LMSW as you finish your degree, and then you get the job. And along with the job comes the supervision. And you need a couple of years of supervision, but you've already got your LMSW. All that is a test at the end of your semester, at the end of your degree. You get the job, you get the supervision, and then you get the license. And
Okay.
so
My
go
vision.
do that. Go do that. Get on it. Yes.
Yeah, I didn't know if it was true or if that could happen. So I appreciate that. Thank you.
You bet.
We have time for maybe 1 to 2 more questions. I think most of the questions in the chat have been answered. There's a question, can we pursue 2 specialties at once? And the answer to that is there's only one caveat there. No, for the most part, except for if you pursue a certification or a leadership certificate, excuse me, or the certificates underneath the CAP concentration. So CAP has a number of different certificate areas that a student could be in within the aging, mental health, and substance misuse, any other specialty, basically, not the CAP specialty. You can't be CAP specialty and get a CAP certificate, but you could be a student in one of the other areas and get a certificate in some of the CAP concentrations. And there are 3 different ones. There's advocacy, there's leadership, and there is, I believe it's an administration one. So they're different areas. Someone can correct me from CAP if I'm wrong, but there are areas you can get a certificate in. There are also, yes, 2 other certificate programs. There's certificate in military social work. We kind of look at those a little bit more distinctively, but yes, there are other certificate areas you could pursue within the MSW as well. Dr. Mitchke also put some information on the 6 other certificates that are available. 4 are leadership certificates, 2 are military focused. And so if you're interested, you can pursue those. So many great options, Dr. Mitchke said, and it's true. I will say.
Can I speak to Claire's question really quick?
Sure, I was going to jump on it. You've got it.
Okay, yeah. So we're actually going to be sending out a degree plan, a degree plan agreement tomorrow. You should receive an email if it's time for you as a foundation student to go ahead and select your specialty. That window will open tomorrow. Also, if you're a graduating BSW student and you've been accepted to the MSW program, you'll get an email that will ask you to declare your specialty, and that window will open tomorrow and close on April 1st. Because that's when registration opens. So you have a limited time to make your decision. And so it'll be open starting tomorrow morning.
Thank you. A quick question. If that's the limited window, you said the new degree plans would be posted to the website by the 1st. Is there any possible way to access those prior to the 1st? Since if the concentration.
Yeah, what you have is really not very different. So what's available now on the website is not different in the sense that the degree plan hours are the same. We've added a couple more electives. And then you identified the one about the program evaluation course versus research 2. But in general, all of the information there is accurate. So yes, we'll work on trying to get them up before registration opens, but just know that the information there is pretty much what you need.
Okay, thank you.
As we come to the close of our time, I wanted to put in one more plug, and that plug is for the field day, the takeover of the UC. That I saw a number of questions about field education in the chat. And field education, that office within the School of Social Work, the Office of Field Education is the best place to get your questions answered about a field placement. And so the takeover of the UC features an entire block of time that's dedicated to exploring field education, to exploring your opportunities with agencies, and to exploring what that portion of your education will bring. There's a lot of dynamic sessions that we'll have that morning, and so I just encourage you to attend that event. And have no fear, if you are an online student and who is out of area, there will be components that will be online and available to you. And so again, register for that event, attend that event, be it virtual or in person, but we know that that's a great opportunity for you to interact with your field office and with the field advisors And if you don't take advantage of that opportunity, still seek information from the field education office. So we thank all of our presenters for sticking with us through the evening. We thank you all as participants for sticking with us through the evening. Congratulations to our winners, and you will receive your gift certificates, and we'll be reaching out to you by email. And again, thank you for your time.
Thank you all. Thank you all. Good night.
Thank you. Good night.
Thank you.